Welcome to our Insight series on organizational well-being. Our question for this week is, Wellness Big Ten, what are the main program intervention options for medical self-care in the workplace? Number 25. As we look at the program area of medical self-care and think about the Wellness Big Ten, and also the options and alternatives that employers have for the kinds of interventions that they can do with employees to help them with their healthcare literacy and health literacy around the topic area of medical self-care. We are going to be doing the same kind of approach we've used for the other areas of the Wellness Big Ten by looking at a parallel as we go through the options. They become more costly to perform or to carry out. They also become more difficult and require more skill to do them. And at the same time, they also, on the positive side, indicate and usually produce more effectiveness in terms of behavior change among employees and their family members. Now, as we think through the various options, one of the things that we can do is we can look at this issue of providing messaging to employees about the value and benefits of being a wise health consumer and learning how to do medical self-care. Now, medical self-care is essentially using physician-derived information to help us make choices about how and what we do with the common kinds of medical symptoms that we all experience. Now, according to the National Center for Health Statistics and the National Health Survey, each individual over the age of 18 in the U.S. experiences on average about 24 medical symptom events per month, or not per month, but per year. So the 2 per month is the average. So some people have more than 2, others have less than 2. But that average turns out to be 24 times a year. We as individual adults usually have to decide, what am I going to do about this symptom or this problem that I'm encountering? So we can provide messaging from the employer about encouraging people to use medical self-care resources. We can also provide those resources to them or refer them to their use online or through other resource channels. The second area that we can do is to distribute to employees educational materials on the basics of medical self-care. There are a number of good resources that we can use that can be actually obtained through the Health Plus Health Plus online worksite or website of the federal government, which contains a lot of medical self-care materials. In addition, you can go to Amazon and put in medical self-care, and up will come a number of book resources and other printed resources. We can also, the third option we can think about is to encourage employees and spouses to seek out medical self-care resources and support. We can encourage health and healthcare literacy among employees and their spouses. The National Academy of Sciences and the National Institute of Medicine have a number of different resources and reports that detail these two areas of health and healthcare literacy. They have been concerned about the diminishing of these areas of literacy among the U.S. adult population. We can also take steps to strengthen our medical self-care cultural norms across our organization, and that's primarily through messaging. It's through people just basically suggesting when you do have a medical problem, that you use some resources to help sort out what to do about that. Not just go to the emergency room, but actually think through what's the best option for me or my family member. You can also have employees search their smartphone app store with the term medical self-care and examine the various options of apps that they can use. If you want to select the best app you feel for your population, then you can promote it and remind people to use it. You can also have a group of employees review the major medical self-care apps and websites and then recommend specific options for the workforce involved. And that also means that if we have multiple workforces and multiple locations where employees are, we can sometimes differentiate our recommendations based on the characteristics and needs of the populations that we're dealing with. We can also provide the best medical self-care smartphone app to employees directly, and or books and resources that can be used by employees and their family members while we promote their use. Another option and alternative, and remember now as we go down the list, they become more costly, more difficult to do, but also likely more effective. We can provide access on the company intranet site and website to a medical software app that can be used by all employees, and that's where we move that app into our own kind of network and our own website and internet site as a company. Another option is to provide a lunch and learn session on using the internet for medical self-care and consumer health education purposes. So we can demonstrate for employees the use of things like WebMD and other types of free online medical self-care resources. In addition, we can also use the opportunity to show them how to evaluate the quality and the characteristics and the pricing of services that they use. So it helps them begin to feel more confident at being able to find their way appropriately through the healthcare system. We also can provide a learning management system module, which includes an online educational experience as well as a quiz to test whether people have actually listened to it and absorbed the content. And then we can also link that to a incentive that we use connected to our health plan in terms of premium amounts that we pay as employees and or other types of incentives. The next option in this, looking at this series on a continuum, is to provide a group of learning management modules on medical self-care and or health consumer education with quizzes and link their completion to your wellness incentive approach. So that's another way of being able to provide an intervention around medical self-care. Medical self-care, by the way, directly affects healthcare costs. So if I'm self-insured as an employer, I can directly affect the dollars that my employees are spending by helping them become better consumers. Also, we can provide a telehealth option for employees so that they can call and talk to a health professional when they are performing medical self-care for themselves and or family members. Another option is to provide an e-health portal with a strong medical self-care and consumer health education component and capability. Another option is to require completion of one or more of the LMS Learning Management System modules on medical self-care and consumer health education issues, and then connect it to our most generous health plan option. And finally, or not finally, but almost finally, provide an ongoing contest where medical self-care vignettes, little situations that you're confronted with that are pretty common to various age and gender components and groups in our workforce, and then distribute them periodically to all employees, and those who want to can provide an initial set of care recommendations and cite their source and be entered into a lottery drawing. The correct answers that go into that lottery drawing are then released to the workforce. This can be separate from or connected to a health plan coverage or health plan premium contribution levels. And finally, we can provide wellness coaches to work with employees and spouses on their medical self-care skills. So in summary, these are the various kinds of program options. As we go down the list, they get more costly, more difficult to do. They take more time and energy to actually put in place, but they are likely to be more effective. In summary, there are many ways to improve the medical self-care and consumer health education skills of employees and their spouses. Each of these intervention options have their own pattern of direct cost, difficulty, and effectiveness. It's also a good idea to consider addressing all the major skill areas of both medical self-care and consumer health education somewhere in your employee wellness program. And we will be dealing with what those skills are in a future video. For more information on this topic area, try putting the following search strings into your web browser. One option would be medical self-care in the workplace. Another would be medical self-care programs for employees, and the whole area of medical self-care. You could also do the same thing with consumer health education. And again, the consumer health education is more of the issue of how do we use the healthcare system wisely. Whereas medical self-care is how do we handle the various medical symptoms that we or our family members have more intelligently. So for more information, please feel free to visit our website at www.chapmaninstitute.com.